Hello there, it's Freddy Verher, Fredosvi, Fred, that's my real name. And Federico asked me via email, what are your thoughts on social anxiety medicines and did you take them? My answer to that was, and the truth of that was, I didn't take them when I was suffering from social anxiety. But because I was thrown into therapeutic sessions and my psychologist didn't talk about social anxiety medicines. We just did therapy sessions over 10-15 times. So I was just thrown into the work right away, and I was motivated to do everything I could on my own to heal from social anxiety. I don't think it ever struck my mind that there was a medicine for it. But my advice to Federico, because he was wondering, should I take them? The pro side of it is that my inner critic that annoys me a lot and is in the way my day-to-day life will soothe. But the downside is that your emotions will flatten, he said. Emotions are a part of your anxiety, so if you're not noticing your emotions, you will just postpone them to the future. Okay, and anxiety might be worse. But this was my advice and my true thoughts. I think it can help you. Medicine, social anxiety or antidepressants can help you if you're doing therapeutic work and a conscious effort every day, at least consistent every week, to take therapeutic grips and explore where the fears and anxiety and the emotional problems come from. And the medicine might help you go through those valleys with less fear and with less resistance, so that you can look into why you are socially anxious and depressed. I don't know, I have never used them, and I don't know how it's going on. And I'm not a doctor, so you shouldn't listen to me, right? But if you take them consistently, you also need a consistent plan of action. If you do them by itself and just go to sleep and go through your day like a zombie, I mean, you're not going to be a zombie, but if you just don't care anymore about yourself and how to get better and how to be able to function, to be a highly functioning being with no medicines, then it's just gonna hurt you. And depending on how high the dose is. Does that make sense? And you should look into research on psychedelic therapy, MDMA assisted therapy. Apparently, according to a study done by MAPS.org, healed PTSD symptoms in 80% of the patients that they tested MDMA assisted therapy. 3 sessions of therapy with MDMA assistance, which makes them less fearful of what they're going to be faced with through therapeutic works. You know, looking at the traumas. It's not as scary if you have MDMA in your system, with a lot of serotonin and less stress. So those are my thoughts. You should look into that. It might give you some insights as far as therapy and the relationship with drugs. Okay, so my recommendation is to, if you're taking medicine, do therapeutic work next to it, or an effort to heal yourself consistently, and not just once in a while. After all, the medicine intake is consistent, so then your actions towards healing yourself will also need to be consistent. Use it as a tool to heal yourself. not a tool to just get through the day. And if you need something to get through the day, you also need to see where the problem comes from. But drugs, medicines can help you, assist you in the process, and lower your guard in the process so that you can really see the origin of your mental, psychological suffering and see the cause and understand it and then heal from it. Hope that makes sense. Let me know in the comments what you think. And there's a social anxiety, social freedom webinar on the top link. There's going to be a 2-hour session with me where I'm going to give my best advice on attaining higher levels of social freedom and less social anxiety. So I'll see you in the next video.